and welcome back to Patient Knowledge. I'm Dr. Kirmani, and today I will talk you through a condition that affects hearing. This is called tinnitus. So let's get straight into it and find out more about tinnitus. In this video, I will give you an overview about tinnitus, its aggravating factors, how serious is this problem, what are its effects on people who suffer from this, and how to manage it. At the end, I will also give you some myths about tinnitus, so stay till the end. What's tinnitus and how common is the problem? Tinnitus is hearing abnormal noise in the ear or head when there is no sound coming from the outside. The word tinnitus comes from the Latin tinere, which means to ring. Although it is usually refers to ringing in the ear, tinnitus may include buzzing, roaring, whistling, hissing, or a combination of sounds. Now, how common is the problem? Almost all of us experience tinnitus at some point of our life, especially with a lot of wax blocking in an ear. It's only a temporary problem. About 1 in 4 people are bothered by it, but it is a severe problem for 2% of the population. Let's have a look at some of the aggravating factors. Ear disorders such as infection of the ears, excessive noise exposure for a long time, wear and tear of the ear with aging, some prescribed drugs, stress and fatigue, and excessive alcohol consumption along with heavy smoking can bring up the symptoms of tinnitus. Social drugs including caffeine and marijuana and head injury are also some of the causes that bring up this problem. Now, what are its effects? The main problem is the psychological effect. Well, it's a no-brainer. People who suffer from this might be upset psychologically, as the noise tends to affect one's concentration, ability to think, and peace of mind. And the sleep is also disturbed most of the times. Now, you must be wondering how to manage it. Well, there are a lot of strategies that helps to manage and cope with this problem. Tinnitus is less noticeable when there's background noise, and therefore it's important to switch off from the ear ringing as much as possible and focus on other noise. The following methods can help one cope with tinnitus. Stress management and relaxation techniques. Since tinnitus is more noticeable when you are stressed, tired, or emotionally upset, learning relaxation or meditation techniques to focus your attention elsewhere may be helpful. Some patients are helped by hypnosis. Now, your doctor will advise on these methods. The other option is background sound treatment, and is a useful treatment, especially for those having trouble getting to sleep. This is to have background music playing when retiring at night. Tinnitus maskers are also available. Some people are helped by wearing a tinnitus masker, which is a device like a hearing aid worn behind the ear. It produces a type of hissing noise that tends to counteract or counterbalance the tinnitus noise. Hearing aids, of course, are helpful. If a hearing loss accompanies the tinnitus, the use of a hearing aid can mask the tinnitus with amplified sound. Now, this makes it easier to focus on outside sound. And there are certain distracting activities which might be helpful for some people. Many people can cope by diverting their attention away from their tinnitus by keeping themselves busy and undertaking interesting activities that focus their mind elsewhere. Some of the examples include gardening, power walking, music, television, handicrafts, jigsaw puzzles, card playing, and discussion groups. Now, most cities have a counseling service for tinnitus sufferers. Now, here are some common myths about tinnitus. According to American Tinnitus Association, tinnitus sufferers in the US number in millions. And with so many people suffering from tinnitus, it's more important than ever to be able to distinguish fact from fiction. Knowing the truth can give you the best chance to effectively approach the condition and reduce the symptoms to improve the quality of life. Now, tinnitus is the perception of sound when no actual sound is present. For many, it's characterized by ringing in the ears, but it can also sound like whistling, buzzing, or hissing. Now, tinnitus is a disease. Many people believe that it's a disease. It's not a disease in itself, but a symptom of any number of underlying medical conditions. Damaging noise, neurological damage, vascular disease, or even traumatic brain injury. It can also develop as a reaction to certain medication. Some people think that I can change my diet and my tinnitus will go away, while some feel that certain additives and foods such as alcohol, sodium, and caffeine can aggravate tinnitus. They're usually not the root cause. Tinnitus management strategies can include dietary and lifestyle changes, but these alone won't cure tinnitus. It's commonly thought that only those with hearing loss get tinnitus. Yes, they are often related, but it's also possible to get tinnitus without having any hearing loss. Few people are of the opinion that everyone with tinnitus eventually goes deaf. Now, tinnitus and hearing loss often coexist, but are separate conditions. Just because you have tinnitus doesn't mean you have hearing loss, and even if hearing loss develops, doesn't mean you are going deaf. Hearing aids can correct hearing loss. It's a popular belief that hearing aids won't help with tinnitus. The truth is that new developments in hearing and technology can address both hearing loss and symptoms of tinnitus by increasing the sounds of external noise, thereby masking the internal sounds of tinnitus. This is known as masking advances, have been made in sound therapy with great success. Now, many individuals are under the impression that there's nothing I can do about tinnitus. Well, there is something you can do. Research into tinnitus is ongoing and treatment are constantly evolving and improving. Whether your tinnitus is mild, moderate, or severe, solutions and treatment are available to help lessen the symptoms and improve the quality of life. It's often thought that tinnitus is only from listening to loud music or using earbuds. While listening to loud music or exposure to excessive noise can result in tinnitus, there can be many different causes. People of different ages, races, health status, and socioeconomic backgrounds can get tinnitus, and quite often there's no obvious reason. In other words, just because you don't listen to loud music or don't use earbuds doesn't mean you're immune. It's considered by many that tinnitus is all in your head. Just because others can't see your tinnitus and there are no test results that will show the presence of it, doesn't mean it isn't all too real. Millions of people globally suffer from mild to debilitating tinnitus. Don't suffer in silence. There are experts that can help you manage your symptoms and improve your quality of life. Now, some people might think that tinnitus is harmless. Fortunately, it's often harmless, but for some people, it can be a warning sign of a serious medical problem, such as heart disease, high blood pressure, or an acoustic neuroma. This is why you shouldn't disregard the ringing in your ears and have a medical professional evaluate your symptoms. Now, that's all for today. I hope this information about tinnitus was useful in understanding everything about tinnitus and how it can be managed effectively. Thank you for listening. If you wish to hear something about, leave it in the comment box below. Bye for now.